Assalamu alaikum, the communication day. First scenario, Mr. Adam, an 18 years old, has been admitted to the ward following a drug overdose. His friends brought him to the emergency department as he was found, sorry, he was found in his bedroom with the door locked and suicide note was found. He was confused and drowsy yesterday, and now he has recovered. He's asking to go home. The nurse in charge told you that his family hadn't visited him yet. Speak to Adam and address any concern he might raise. Okay, ready, Dr. Lamis?
Yes.
Okay, here you go.
Hello. My name is Dr. Lamis. I'm one of the doctors in the ward today. May I confirm you're Mr. Adam and you are 18 years old?
Yeah, I'm Adam, yeah.
Hello, Mr. Adam. I'm here to discuss your health condition. Is this all right with you?
Yeah, whatever.
Okay. So, Mr. Adam, I would like to assure you that this meeting, our conversation is confidential, and I'm here to help you as much as I can. I'll do my best to help you today.
Mm-hmm.
So, Mr. Adam, can you tell me more about what brought you to the hospital?
Well, I don't remember actually.
Right. I appreciate this must be a very difficult time for you, and I'm sorry if this feels overwhelming to you.
Mm-hmm.
Are you okay to discuss right now?
Yeah.
Yeah. So, I understand that this must be difficult. So, I can see from your notes that you have been brought to the hospital by your friends. They brought you to the emergency department, and this was following you've been found in your bedroom with the door
Mm.
locked. Um, any do you remember what happened?
Um,
Or is it
After that, I don't
okay for
remember
you
what
to discuss
usually
now?
happened. Yeah, I didn't. When I woke up this morning, uh, I found myself here, to be honest. But um, uh, I didn't know that my friends has brought me here. But yeah, um, can you hear me? Hello?
Right.
Oh,
Yes. Yes, I can hear you. Yes.
yeah. Hello? Hello?
Yes, Mr.
Oh.
Adam. So,
Yeah.
you've mentioned to me you haven't realized your friends
Mm.
brought you, but prior to being brought here, do you remember any details about what happened?
Um, so I was trying to sleep, to be honest, and um I took my sleeping tablets and then pretty much I don't remember.
Right, okay.
Mm.
I thank you for telling me this, Mr. Adams, and I'd like to remind you that this conversation is confidential, and I'm here to help you as much as I can.
Mm.
So, when you took the sleeping tablets, have you taken any more of what you usually take for sleep?
Yeah, actually, yes.
Right, okay. And are you currently having any difficulties, any difficult time you're going through?
Um, Not in particular, to be honest. It's just um, I feel worthless. I'm fed up with everything.
Right. I'm very
Mm.
sorry, Mr. Adam, you're feeling this way.
Mm.
And I understand this must be a very overwhelming and a very tough time for you. Um, so when you took, I understand you've been feeling really low
Mm.
recently. Was it with the intent of any harm to yourself? Because there's a bit of concern that you also wrote something, you wrote a note. Do you remember any of this?
Yeah, to be honest, yes.
Right, okay. Um, so are you happy for me to go forward and discuss what would be the plan right now?
Mm. Well, actually, doctor, I feel all right now. I can't go home.
Right, okay. I understand that now you're feeling better physically. That's very good to hear that you want to go home and you feel better. But because you came in after an overdose, and also because you haven't been feeling really well mentally recently, and there's also concern that you also wrote a suicide note. So, my main responsibility is to make sure you're safe before any decision about discharge is made.
Mm.
Um, how do you feel about this?
Well, what do you need to check for?
Right. So, in usually in these circumstances, we want to make sure that you are physically okay, and also we need the help of a mental health specialist to include the mental health team for an
Hmm.
assessment, just to make sure that you are all right, and if any due support is needed for you, then you receive it.
Okay.
Okay, so.
Yeah. Yeah.
Um, Right, okay.
If
So,
you say so, yeah, I'm fine with that. Would they be seeing me today?
right. I'll check for now, and I'll come back to you with an answer then, when
Hmm.
you will be seen exactly. Okay. I don't
Okay.
have the answer right now, but it's very important after this serious overdose event that you are seen by the mental health specialist.
It's just a bunch of sleeping tablets. It usually doesn't cause any harm, doctor.
Right, I understand. I understand that this is being like sleeping tablets, and this time you are okay and nothing happened. But we're quite concerned.
Mm.
If you're feeling low, if you're feeling this way, then this might happen again. And next time, sometimes it could be more serious. You could have some side effects, some serious side effects from the overdose. So we just
Two
want to
minutes
make sure
left.
that we're giving you the help you need.
Yeah, but you didn't mention any investigation you would like to do. You just wanted me to see the mental health, which I'm okay with, because last time this was happened and the mental health saw me and set up and then they were okay to discharge me. So
Right, okay. Um, right, okay. So they will assess you again
hmm.
after the suicide attempt. And if any investigations are needed, then they will let you know about what investigations are needed. Uh,
Hmm.
so I can see that you I can see from your notes that your family has not visited yet. Um, would
Hmm.
you like them to know anything you want to tell me about this?
It's fine. They are living in a different city, to be honest. They're living far down in the south. They might come today, later. Yeah.
Right, okay. And are you well supported? How are you coping at home?
I'm in a university apartment, and I find it difficult to settle within the new city, to be honest.
Okay. And do you need any support in regards to that?
Well, I, yeah, I'm happy for support. Yeah.
Okay. So I will involve a social service and see explore what
Yeah.
kind of support you need and
Time,
offer you. May I know
time's up.
if you smoke or drink alcohol? Okay, right, okay.
Yep. Yep.
Yeah, time is up. You can comment now based on the skills, Dr. Omar.
Um,
Yes, I'm not good with the suicide scenarios, but
no,
I'm happy to hear the feedback.
okay. So first of all, the information is there for you to use it for him to be open up. There is a misconception that whenever you use the phrase, this meeting is confidential, any medical meeting is confidential. Yes, you're acknowledging it, but this you don't expect that the surrogate would be open. You need to use what you understood from the scenario to your position. So he was confused and drowsy yesterday. You can use like an icebreaker. How do you feel right now? Do you recall anything what happened? He will tell you no. Then you should go to the next phase. Okay, your friends has brought you in a very um um like you wasn't doing very well last night. Any ideas about what might be going on? He would tell you, no, I barely recall anything. Then okay, um, we have found they found you with the door locked. You can use the yeah, the this meeting is confidential. Is there anything you would like to share with me? He would tell you, yeah, I've taken a bunch of sleeping tablet, and here you should acknowledge, okay, was it to help you sleep? He would say yes, but we found a note, Adam. Adam would say, okay, to be honest, I was taking them. So this is the first time. You need to ask history in this scenario. Is that the first time? From where he get the bell? How many? What he took with? Did he took it alone? Because he was confused yesterday. Till now, you are the first doctor to speak with him after he was recovering. He will tell you, yes, I've taken it. It's from my GP. So we need to know the source of the tablet. Is it a legit source or not? And then you can ask about the stressors. He would tell you that I'm trying to settle in, no friends, no, I'm living away from my family. Okay, do you need any help? Then this is not the first time. Then he would tell you, yes, I want to go home. You've answered this correctly. Yes, mental health needs to see you, and the surrogate would agree. Yeah, but I tried to prompt you that this is not the first time for you to recall before the end about uh, the tablets itself because it's not written in the scenario what tablet. It could be paracetamol, it could be whatever tablet it is. Um, so for the clinical communication, um, um, I would say that your communication you was not confrontational. You was patient. You give relevant pauses. Um, I would say satisfactory. For the clinical judgment, I would give borderline because you didn't allocate any relevant um, information about his overdose, and the mental health is not the team that would authorize any testing or request any investigation. It is the medical team which you are representing. You've managed the concerns. Yeah, all of my concerns has been answered. You've maintained the welfare, so I will give satisfactory, satisfactory. I will give the clinical judgment as borderline. I don't know if Dr. Basim would agree with me or not.
Yes, Dr. Omar. I agree, apart from the mental health, which is a must be included in this scenario.
No, no, no. I disagreed about the mental health would request an investigation. This is totally
No, no,
wrong.
they are not investigating. They are just following the social and the
Mm,
psychological point of view. But for others, the multidisciplinary team or the group of doctors, they are following you in order to be sure that you're physically and mentally okay. Which he mentioned already. You are physically or mentally or both of them. Okay, so it's a matter of both of them. The health, either physically by doing some investigation, blood workup, imaging, maybe a scan to deliver. You don't know what she took with this sleeping pills, which is something need to be asked. I prefer to ask about the circumstances in details. What you have taken, is it with alcohol? Of course, he locked the door. He wrote a note. It sounds that it's suicidal and serious, real suicidal attempt. And if the friends are not there, it might succeed in the next time. So this one has a real, and it's a second time. So we have to take it seriously. Don't miss it. That's why I like when she mentioned the mental health should be offered or should be met in another appointment to assess your mental health. But of course, you have to be followed by other doctors, group of doctors. And if you know what other pills she took, you will talk about what else can be included. For example, if paracetamol is there, you can say the gut or the liver doctor, right? But what Dr. Lamis missed, the circumstances. She didn't ask. She assumed it's suicidal attempt, but you have to know what exactly she did or he did, what he took with these pills. What is the pills? He was the volunteer to tell you I took sleep pills, but you have to ask. Okay, the alcohol itself maybe also will add more toxicity if he took it with alcohol. Okay, Dr. Lamis. So how are you?
Yes,
What
I
do you do?
do.
Yeah,
Yes, I do.
I think you start the scenario like confused what to do. Please, if you are,
Uh,
yeah, let me
okay.
give you advice. Whenever you
Yes,
are
sure.
in communication scenario, start by our algorithm. How are you? How do you do? I am Dr. X, one of the doctors. You are Mr. X. You are 30 years. We are here to discuss about your health issue. If you have something confidential, like our scenario today, which is the suicide attempt, be sure this meeting will be confidential between me and you, unless something or someone will be hurt. So we might breach this confidentiality. You can say it if you, or you can say it's confidential between me and you, and go ahead. Let us know what exactly happened with you. Tell me in details. Let him be feeling calm, and he will try to open up. If not, you can again reassure him. Then you can ask him, "What do you think ongoing with you?" Okay. If you are in doubt about the scenario ideas, just start in this way: the background and expectation. And believe me, the surrogate will open up. If he hide or try to hide, you can try to raise an issue or concern and let him open up by another question. Let me be sure that this one will be confidential, and try to ask about the circumstances. But the introduction today wasn't that much confidence. Although you are perfect in the communication, what I know, you have practiced with me a lot. You are perfect in the communication. But the suicidal attempt, it's good to practice it today. You might have it in your exam. So please be ready for that such scenarios. The suicide attempt come in every scenario, in every diet. In Egypt, sometimes also they brought the paracetamol toxicity. So be sure and be
Okay.
ready about that. Okay, what you want to say?
I just wanted to say, to be honest, the suicidal attempts are not my cup of tea of communication, but of course, like I have to cover it very well. It's just the balance between, the history taking because
Yeah,
I was trying like like I was insisting on the same point, assuring confidentiality, asking, allowing like the surrogate, even though he opened up and he was very good at telling me and spilling the beans, but I I did not want to ask so many questions like history taking to get into that so much. I think that that's my shortcoming and my pitfall in this scenario. You're right, like I should explore more because this is the essence of the scenario. The tablets, the overdose, is it the first time
yeah,
to happen?
yeah.
Y-
Let me assure you that the only scenario you can take history, not full history. I'm talking about the circumstances of suicide attempt. Why? Because you can decide and you can judge on that. Either this
Okay.
patient do it in suicidal way or just paying attention to others. So you have to do it. Okay? Yes, Dr. Amma, what you want to say?
it's just use the scenario to your advantage. Every information written in this scenario is written for you to use it. So they wrote, he was confused and drowsy yesterday. How do you feel this morning? As a startup, as an icebreaker. Okay.
Okay.
Do you feel well now? Yes. Well, I'm here to speak with you because the nurses was telling me you can use it as a startup. Other candidate will he would start. Okay, I'm here to discuss what brought you into the hospital. Is that appropriate time to speak with you, Adam? He would say, yeah, I'm sitting here doing nothing. Another candidate might be using, okay, the nurses was telling me that you would like to go home. In order to discuss this, I would like to discuss with you what's been going on. Do you recall anything that happened yesterday? You would tell no. So your friends brought you because they found you. Do you have any explanation about that? Uh, I will tell, yeah, I was taking some sleeping tablet, but as soon as he mentioned, you didn't know what sleeping tablet he's taking. You should know what
Okay.
tablet, exact tablet. Zobiclone. From where did you usually having a sleeping problem? Is your mood is generally low? He would tell yes, and then okay. So how many pills you've taken, if you don't mind sharing with me, and everything you say remains confidential. Here you can put the confidential card, but what I felt is that you are trying to do, I'm showing my confidentiality card, please open up. This is how it
Yes,
sounded.
that's
Um,
exactly what I was trying to do.
okay,
Yes.
I'm trying to tell you again that that it is a this meeting is confidential, which is in every medical meeting, it is confidential. It is something that the people should is aware of that is confidential. You can use it to enforce the setting, but use it smartly. You can do that. Yeah. You, mashallah, you do have the linguistic skills and the communication skills to infuse the words within the scenario without sounding robotic.
Right, okay.
This is
Yeah.
like an advice for you.
Yeah, thank you,
Yeah,
Dr. Amma.
this is quite valuable. Yes, I appreciate it.
Yeah, I want to add also about discharge. This patient never ever you let him go home,
Yeah.
which is good. You didn't allow him, you didn't give him chance to tell him that he's okay to go home. You told him that he should be seen by the mental health team to reassess him for two reasons. Because this is a very serious one attempt, I mean, and he had previous one. You can add also another information that his parent didn't yet visit him. So all of these data will not let this patient go home. Okay. So I
Okay.
can give you a welfare as satisfactory, and the concern as well was satisfactory. Sorry. But the clinical communication, as I said, because you didn't ask more about circumstances, I can minus you borderline. Or the last thing, the clinical judgment as well, because also you didn't tell him what's the plan. Is it only mental health or follow up or investigation? Please take care of these things because the communication skills linked to the clinical judgment in this scenario. Whenever you will explore the circumstances, you can decide and you can judge properly. Since you didn't explore them, you couldn't judge properly. However, the most important part in this scenario to include or to add the mental health to assess this patient. Okay, which is good. You at least you did it. That's why you can gain good mark. Okay. Okay, Dr. Lamis, you can share your scenario for Dr. Omar, please. Sorry. Anyone has a question for Dr. Dr. Lamis or Dr. Omar? Any question or comment?
No, I think I don't want Dr. Lemis to feel down. We are it's better to commit the mistakes here rather than in the cubicle.
Yeah, sure, sure. She knows that she's mature enough to know how to learn from this lesson and to learn from this session, uh, because she's doing well in all stations and all scenarios. Maybe this is first time to practice suicides, but it's good time also to know and the opportunity today to learn the mistake better than the exam day. Thank you, Dr. Omar, to let her practice this scenario because whenever you are lacking in an idea, it's better to be done in the session rather than in the exam. Okay, let's read the scenario for Dr. Omar. Your role, you are the registrar in the rheumatology ward. Mrs. Jones, 75 years old woman, known history of osteoporosis, was admitted 2 weeks ago. Due to chest infection, she had been taking Alendronate for her osteoporosis prior to admission. While in the ward, she developed epigastric pain. Her hemoglobin level dropped slightly. As a precaution, Alendronate was withheld and she was started on a proton pump inhibitor. An endoscopy showed mild gastritis, supposed esophagitis. Anyway, an MRI scan for new back pain revealed compression fracture at level of T4 and T11. Today, you will meet Mrs. Jones' daughter, who is concerned about her mother's ongoing treatment. Your task is to talk with her elder daughter, Mrs. Julia, and discuss her mother's condition, address the concern she might raise. Good scenario and no new idea. Good luck, Dr. Omar. Whenever you're ready, let's know. Let's start. Anyone want to comment about the previous scenario? To add an idea? To ask a question? So waiting for Dr. Omar to start?
Just give me 1 more minute, 1 second.
Yeah. It's okay. I'm waiting for you to inform me. I will add a last comment before Dr. Omar will start. You will be lucky if you have a scenario clear. This suicidal attempt was serious. Otherwise, if you have doubt about it, you will be in doubt during discussion. Is it serious or not? So you have to know from your assessment and before deciding for mental health, you have to know is it serious attempt or just, as I said, fake one. Since this patient locked the door and wrote a note, it's clear and straightforward. He's very serious to kill himself. So never ever discharge this patient. The doubt always or the conflict always whenever you have patient without clear details or information that this patient had this attempt, serious or no. Whenever you have it, again, let the mental health team to see this patient.
Yeah, thanks, Dr. Bassem, for bringing this up. This has reminded me of two more things to be
Yeah,
added in this scenario. Usually, it's a guidance. Not all of the books can be ticked within 10 minutes, but
yeah,
the insight should be acknowledged
yes,
during your conversation. Now,
yes,
knowing that you are doing well, how do you feel about it? It's very important. And every time I do forget about that. When I practice the scenario, I forget about the insight. Acknowledging the insight would let the examiners know that you are trying to look 360 around the case. Yes, he had insight. This is his second attempt. It's serious. You referred him to the mental health, so your clinical judgment is fine.
yes. As I said, and Dr. Omar also confirmed that you have to know the circumstances well. The second attempt, taking more tablets or more pills, maybe one tape or two tapes, taking another medication with this medication, so paracetamol with sleeping pills or paracetamol with antidepressant, or taking them with alcohol, or locking the door, or writing a note. No one, or he didn't call for help. He found that while he's in his bedroom, they noticed that he's not replying. Then they saw him locking the door. All these details guide you to a serious attempt, suicide attempt. In this time, even the patient is asking to go home. I am fine, doctor. Don't let him go home. If you allow this guy to go home, they will minus you maybe in the. They might fail the all station, not only the skills of clinical communication or welfare. Okay, don't discharge any patient with very serious attempt with the data I mentioned earlier. Clear for all because it's usually coming. Okay, let's start the second scenario. Dr. Omar, ready?
Yes, is it gastritis or esophagitis? Just you because it's
What I
written.
know, the alendronate or the bisphosphonate
Yeah.
affecting the esophagus
Yeah,
or doing esophagitis. So I
mhm.
think, Dr. Namis, you meant esophagitis, right? Anyway, follow that scenario. So trust the
Okay.
scenario.
Okay,
Forget
I'm
my.
trusting
Yeah,
the scenario. Okay.
yeah, yeah. Okay, you can start now. Dr. Namis, you ready? I cannot hear you.
She might be away. Just give her
Okay, she's not in the
one
list. No,
minute.
no, she's in the list. You can
Yeah,
unmute yourself, Dr. Namis. We cannot hear you if you are talking.
Oh, sorry, I was
You
talking,
will
I
do.
didn't realize.
No, no.
Yes. So I,
Oh,
I found it in the recall, I found it as gastritis and I just copied it as I found it in
okay,
the
it's
recall.
okay.
okay. But
Uh,
medically, as we know,
it's
it goes.
esophagitis, I know. Yeah.
So yeah, perfect. Yeah, let's start. Here you go.
Hi, is that Miss Julia?
Yes, I'm Miss Julia.
Hi, I'm Omar, one of the doctors here in the ward. I'm here basically to give you an update about your mum's health, and also I've been told that you have um some concerns you would like to share with me. I'm here to help.
Right, okay. Thank you for seeing me today, doctor.
Yeah.
I'm quite concerned about my mother's condition, and I know she's being admitted. Like recently, she had this chest infection, and
Mm-hmm.
she's being there, and she improved while she received her antibiotics. But I'm quite concerned with this tummy pain she has developed while she's in the hospital, and then I was told that her blood levels have dropped slightly. And now I'm told that she's developed a new fraction. I'm quite concerned how she could develop this in the hospital.
Well, thanks for sharing this information with me. It is what you've said is quite true, as I can see from her notes. Um, so yes, she's been admitted for chest infection, and she has developed a drop in her hemoglobin. And she is usually taking Alendronate, which is one of the medications she takes for osteoporosis. Um, and um, As any patient on alendronate, basically, or any patient who does develop a drop of hemoglobin, we're trying to understand why he has dropped hemoglobin or why this patient has dropped hemoglobin. So the team did an camera test, and the camera test showed mild inflammation in the stomach, which is inflammation in the lining of the stomach, and they call it gastritis. So what they advise is to hold the alendronate, which is quite common to cause irritation of the gut, and
Mhm.
in, yeah, and then to give a bit of a time to the lining to heal up.
I understand, doctor, but I know that we've been told last time that she had very fragile bones and that alendronate, her doctor said, should not be stopped at all. Do you think that this fracture happened just because the alendronate was stopped? And
Well, mhm, mhm.
was
I'm
the
sorry,
drop
yeah.
of her hemoglobin serious? Like, was it serious warranting the alendronate to be stopped?
This is a very good question. To be honest with you, I don't have the numbers in front of me of how the hemoglobin was dropped, but I can understand that it was concerning to the team, so they have requested in a camera test. So I feel that the hemoglobin drop at that time when it happened, it was concerning to the medical team. So this is why they took a precaution of stopping the alendronate. Yes, she has a fragile bones. There is going to your second question, which is about would stopping the alendronate basically can increase her chances of having another fracture. Given that it is stopped briefly, I found this less likely, but it can be. Also, although many patients who are having fragile bones can develop fragility fracture or fracture without significant trauma to the back, to the hands, or to the femur or the hips, basically. So this can still happen even if she was on alendronate, not your mom specifically, but many patients do develop fracture even though that they are on alendronate.
Right. Thank you for explaining, doctor. So what's the plan now? Is she going to get back on Alendronate and is her fracture going to heal?
So for the alendronate plan, we need to liaise with our gut doctors, basically. Um, they have advised for a PPI, which is a medication to lower down the amount of acids that's being produced within the stomach itself to give time for the stomach to heal. And usually they will advise to restart it with education about the proper sitting after taking the medication. Sometimes they we can have an alternatives to the oral, the tablet, which is can be given through the veins, but this depends on the consultant review, to be honest. Regarding your second question about the fracture, we I don't see in the notes in front of me if there is any plan from the neurosurgeons who took care of the back fractures in the backbones. We need to liaise with them, to be honest. And we can give you an update and to give you Mama an update about this plan. But what happens usually, there is an MDT. Where do they? I mean, it's a form of a meeting. Where do they review the imaging itself of the back as your mom had an MRI scan, um, and then to give their recommendation whether they would do recommend going for um, uh, a surgical procedure or to manage conservatively. Conservatively mean with physio and with bone protection medication, um, not with surgical.
Right, okay. I understand this, doctor. So, does this mean she's staying still in the hospital for that kind of management to be completed?
Yes, I do believe so. At the time being, we usually they would advise us or and advise the physiotherapist about how can we mobilize her. They would give us a guidance. Usually, the neurosurgical team do have the to clear her for starting mobilizing.
Two
Does she
minutes
have any
left.
does she have any problem in mobility as usual?
Well, she was well mobilizing prior to
Hmm.
this in the house before having her chest infection.
Hmm.
But for now, I saw her this morning and she's not able to move. She's quite unwell. So I'm not quite sure what to expect in terms of her mobility now.
For mobility,
Um,
usually. Oh, I'm sorry. Yeah, continue. I'm sorry.
yeah, but yes, well, prior to this she was quite okay, but now she can't move. So I don't know what to expect. To be honest, doctor.
So if she cleared by the by the neurosurgery, that she is not considered for surgery, and now they will signpost her for our physio team to take care to take care of her. Then they start assess her baseline and to establish a program where we can what they can achieve with her to be as close to her normal baseline. This would start in the hospital and likely it will continue while she's going back home.
Right. Okay.
Okay. Does she where does she live in bungalow house?
She lives with me, doctor.
Okay.
We have stairs in the house. But I keep her in the downstairs usually. She doesn't go upstairs.
Yeah, our occupational therapist, to be honest, would visit her home, recommend some adjustment for her before she discharged to her home. Any other question?
Right. No, thank you, doctor. You
Thank you.
answered all my questions. Okay.
Okay, time is
Thank
up.
you.
Dr. Lamis, your time to comment. The skills in the
Yeah,
chat.
yes, I think the scenario was well addressed. Like all the points I had were covered. He in terms of clinical communication, everything was explained quite well. Bomber, he did great establishing a report with the daughter, explaining everything, explaining why the Alendronate was withdrawn, and that still the most important point in this scenario is highlighting the importance of withholding the alendronate based on the drop in the hemoglobin and whatever, whether it was a gastritis or esophagitis. So this was the most appropriate action to take, and at the same time, that highlighting to the daughter that still, even with the alendronate, because she has osteoporosis, fractures can happen, does not mean that they will not happen. And also stopping the alendronate for a short time will not result in a fracture particularly. So in terms of clinical communication, everything was covered. So I think it's satisfactory. Clinical judgment as well. The plan was explained. Possibilities. It could be, it may warrant surgery. it could be conservative. If it's conservative, then it was explained. All concerns were answered, and in terms of welfare, I think it was also covered. So for me, it's a satisfactory performance.
Perfect. But I will minus him in the clinical communication because two times interruption. Two times you were talking and he stopped you. Yes, maybe because of the online ongoing session, but it's a lesson. Don't stop or don't interrupt the surrogate at any time or at any point. The examiner being irritated by this thing. Okay, this behavior always irritate the examiner. They might minus you in the clinical communication, but it's okay. Maybe it will be an excuse whenever we are doing this online. But even on the online, let the surrogate finish the talk. After that, you can comment. The clinical judgment went perfect. I think all point he mentioned was perfect. Either holding the medication or treating the camera scan. There is some jargon he used, but he corrected lastly. And the importance of being on this medication to switch to another formula, either IV or another medication based on the consultant decision, which is good. He didn't do it by himself.
Yeah, offering alternatives, yes, for
Perfect.
the
Yeah.
and also like for the jargons, I think because like in the UK, most of the things Dr. Amr said are
Yeah.
acceptable. In the overseas, like they would be a bit very particular about using some terms, but I think I did not find particularly jargon given that he's giving his exam in the UK, so I don't think that that's a problem.
Yeah, we are talking about the optimum. We don't want to
Yes.
have any mistake, although it's different here and the judgment will be different overseas than the UK centers. Always they accept these jargons or these terms. However, we always look for the perfect and the optimum as a performance, okay? The concern and the welfare always maintained, kept maintained by Dr. Omar, but I preferred at the end to ask with whom your mother living and don't restrict the question. Is it bungalow or is it house? Just offer or ask her where she lives and who's dependent or who's helping her or taking care of her. Don't ask who's dependent because her mother need to be dependent, not the one who's helping her. So the one will help her. You have to offer support for them with whom your mother living and who's taking care of her. Okay, usually you ask who's dependent on your mother. But in this scenario, the mother will not help the carer. In the opposite, the carer will give the support to the mother, and we will offer the support for the carer. So the daughter here will be offered any support she might need if she in need. Okay, what to do? To ask again, with whom your mother living? She will tell you, yes, doctor, with me. I'm the one taking care of her. Do you need any kind of support? And we will refer you or your mother to the occupational therapist. They can help you to let your mother cope with your with her daily activity at home. Always appreciate what she's doing for her mother. When she told you, doctor, I kept her on the first floor or the ground floor, you can appreciate that by saying, oh, it's good for me to do so. So she's easing her things in the life by doing or putting her in the first or the ground floor. Appreciate always what the carer give to the mother or to the patient. Okay. Otherwise, you did perfect. So the marks, as I said, you will just be minus 2 marks in the clinical communication or 1 mark. If one examiner will give you borderline, so it will be 1 mark. So 15 out of 16. If both examiner give you borderline, it will be 14 out of 16. Okay. Any question, Dr. Omar, or comment?
So as a reflection, I also forget to acknowledge um, uh, uh, the first C that we spoke about. That her mom is happy for her to speak with us Should be acknowledged by myself at the very beginning, which I forgot.
Yeah, perfect. Yes.
The other thing is the coping. So we talked about four C's: consent, concern, coping. So coping, how you are coping with your mom's care. This should have been asked, to be honest, by myself, and then offering the carers. But I touched base with the carers, but I didn't ask about how she's coping, although I had time to ask about it, to be honest.
Yeah, I believe you have good time. At the last minute, you can do it. And a good thing also, you ask for the permission. So we had a permission from mother to talk about her condition, which is good also to be in the introduction. Yeah, perfect. I think you are learning how to do it perfectly. And again, we are aiming for the optimum and the perfect performance. Do you
Yeah.
have any question, Dr. Omar?
No, 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 no.
Okay, Dr. Lamis?
Nothing to add. I think like even with the trivial things, Dr. Omar definitely like aiming for perfection. But I think the he covered the essence of the scenario. The essence was like explaining like the fracture, the alendronate, the management plan, everything, and he was quite empathetic. So I feel like if the surrogate was more difficult or insisting that this fracture has happened because the alendronate um, was stopped, because when I heard the scenario in the recall, they said that to some of the surrogates that were not quite empathetic in the scenario, the surrogate became a bit difficult, and she was saying, "You have caused the fracture because you have stopped the alendronate and everything." Uh, so the surrogate, because the candidate was not very empathetic with her, she was instructed like to become more difficult. But I think with Dr. Omar, it will go quite smooth, because he hasn't asked about the coping and thing, but I felt the tone was very empathetic, and he was very caring, like someone who really cares for the patient and who wants to help, and he knows all the details. So for me, Dr. Basim, I'll give the I will give a satisfactory in all the aspects.
It's okay, Dr. Lamy. Thank you for this judge. However, as I said, it's a variable from examiner to examiner or from person to person. For me, I will give him, so it will be 15 out of 16. Okay. If one examiner give borderline and the other give satisfactory, means that he will be minus 1 mark only. But again, be ready. It's a good point to be paid attention by Dr. Lamis. Be ready to have
Right.
a very difficult surrogate who will
And the
fight.
surrogate,
Yeah,
yeah, and the surrogates are instructed. If you watch
exactly.
the
Yes.
video that for the
Yeah,
calibration, they instructed to change that, not to change, but to adapt their responses depending on the interaction they receive from the candidate. So some candidate might start it differently and shoot himself in the foot. Uh, he's giving an excuse for the surrogate to be argumentative or to be more angry because he listed the sequence of event in a way that would make the surrogate assume that stopping alendronate went. So he will conclude, okay, so you've stopped the alendronate. This is why she had a fall, or you you weren't too sure. So he would tell you, did she had a fall in the ward? It's not written in the scenario, so you would tell no. It's not in front of. There is no documentation for me that she had a fall, for example. So it depends on how the surrogate would, how the candidates would explain the things to the surrogate.
Yes, exactly. That's what I was saying basically is so the surrogate is performance is guided by how the candidate does, and the sequence he would go through and listing the events. Some of the candidates said it could be due to the alendronate being stopped, and this is when the surrogate became more and more argumentative, focusing on the point that that's the main thing, like the main event that led to the fracture, and hence they would take you down the road of a medical error, like you stopped the medication, you've caused this, and so.
Yeah, I'm also here to say it's not an error at all. No one do it as an error.
Yes.
No apology. Don't admit any mistake here. Unless there is clear data that this patient stopped Alendronate for a long time, for example, no one resumed it, or no complication happened, but it was stopped by the, for example, the GP to investigate the hemoglobin drop, but when the camera scan done, he didn't resume it. What I mean, any reason, suppose this medication to be kept on, and the patient he is not on, it could consider as an error. So you have to apologize. Otherwise, everything went smooth without any mistake in this scenario. So no need to apologize at all. You can be sorry. I'm so sorry for your mother suffering. I know it's difficult time for her, having this fracture because of either side of effect of the medication, or she's not on the medication, whatever. But don't say there is an error or to assume there is an error unless it was again written in the scenario. Okay. Any other comment, Dr. Lamis?
No, no, that's fine.
Okay. Since this is the last session in 2025, I would add some minutes for the judgment on the skills, just to be aware how they are judging. Okay. Because I wish all of you, 20,026, they will pass this exam.
I mean,
Yeah, and I want everyone to know what the skills and the marking sheet is going, how it goes. Because if you don't know how they are judging you, maybe you will not success, or you will not pass this exam, or you will not have the success in this exam because because of the lacking in the way of the judging. So let's start from the point of our communication. The communication skills is 16 marks, means four skills. As I wrote in the scenario, in the chat box, the four skills are clinical communication, clinical judgment, the concern, the welfare. These are the least skills in the whole exam, 16 out of 16. The other skills, other station will be 20 for the short and 28 for the long, because they added two more skills or three more skills. So let's talk about how they are judging, how I get 16 or 15 or 14, and how they are judging in every skill. So let's say, assume the first skill, which is clinical communication. If one examiner are satisfactory or give you satisfactory in this skill, one examiner give you, or both examiner, let's start by two examiner give you satisfactory. So you will gain, or you will get 4 out of 4. Okay. If one examiner give you borderline and the other give you satisfactory, so you will gain 3 out of 4. The last, oh no, no, before the last. If one examiner or both examiner give you borderline, so you will get 2 out of 4. If one examiner or both examiner give you unsatisfactory, or let's say if one examiner give you unsatisfactory and the other one give you borderline, you will get 1 out of 4. The last thing, if one examiner give you, or both of the examiner give you unsatisfactory, you will get 0 out of 4. Okay, based on this, all the skills will be judged in this way. Whenever you have satisfactory in both examiners, you will gain full marks in the all station. Any examiner will minus you, either borderline or unsatisfactory, so it will affect the all, or one skill, and it might affect the all performance in this station and even in the all stations and in the general mark sheet. I mean the exam at all, generally. So again, two examiner satisfactory, you will gain 4 marks out of 4. One examiner satisfactory, the other borderline, you will gain 3 out of 4. two borderline from two examiner, 2 out of 4. One examiner borderline and the other unsatisfactory, you will get 1 out of 4. Both unsatisfactory, you will get 0 out of 4. And this is the least mark, or the least and worst mark. Okay. But don't worry, sometimes you can pass even in this station, or you will not pass in this station, but you kept or you maintain the all skills all over the exam. That's why, please, don't give up whenever you are doing a station bad. Continue the performance, continue the confidence, and try to get the trust from the examiners in the next stations. Whenever you gain or you get full marks in one station, it can help you to raise the mark in all over. But if you gain or you get fail in 1 or 2 station, I'm so sorry to say, it might be or it might not be your day. Okay, so please, at least one, maximum 2 station to be like bad performance all over the day. But as general, one station, if you do bad, you might still have the chance to pass this day or the all exam. Okay. Anyway, whenever you are doing bad, don't think about it. Forget about it and continue to the next station without thinking about the previous station. Just forget it. Otherwise, you'll keep thinking what I should do, why what I shouldn't do, until you will be in the next and the next station. Maybe the old station you will do bad because of the first station. And that's why I hope that the bad or the worst station will be the last one. Why? Because whenever you do, it's the last one. It will not affect or you will not think about the performance anymore. You are finishing the station or the day. But if you started with the bad or the worst station, unfortunately, it might affect the all performance in the whole day. And it depends on your stress control. If you can control your stress, you can do it. If not, unfortunately, you cannot do it. Okay, this is regarding the skills, how it goes, because I think most of the candidates they don't know how to do and how to understand it. You have to look at the marking sheet at all exam. Why? Because some skills you have to pass separately. For example, the clinical communication, I think it's 12 out of 16. If you want, if you want to pass, this is skill in particular. You have to gain in all station 12 out of 16. And for example, the welfare 18 or 28, sorry, 28, 28 out of 32. In this way, you have to look at the sheet mark, because if you will not understand, you might repeat this exam twice or thrice even. You have to know how to maintain the skill in every station. Let me give you the last example before ending this session. The concern. Okay, I know one candidate who missed the concern totally in one station. That he didn't manage the time well, and he didn't ask about the concern at all. When he heard time's up, was the time to ask what's your concern. So it's considered like he failed in this skill in this station. So 4 marks minus. Okay. What you have to do to pass this skill in particular, you have to fulfill the skill in other station, all of them. If other station you miss the concern, unfortunately you will fail the whole exam. Okay. So what happened with him? He did the other concern in other station, means that the other concern in the clinical communication station and the long clinical consultation. You don't have concern in the short, okay? And he passed the exam 12 out of 16 as in this skill. And the pass mark is 11. So again, if you miss 2 concerns totally, know that you will not pass this station, and you will not pass this skill, and you will not pass this exam at all. Okay, based on this marking sheet, you have to know what exam and what skill, how many skill in how many station I should pass. If you know how much and how many station I should pass this skill, you will know what to do in the exam and what to have, and you can pass safely. Okay, so the aim and the take home message: don't miss a skill in two stations. Try, if you didn't do one skill in the first or one station, try to compensate in other station. If you miss the skill twice or thrice, know that you cannot pass this exam. Okay, skills mean either clinical communication, concerns, welfare, or the differential diagnosis, clinical judgment, and the concern. By the way, welfare, if you fail in one station, the welfare, you don't have a chance also to lose another mark in another station, because the pass mark of welfare 28 out of 30 of 32. So if you fail it, or you fail to pass the welfare in one station, you don't have any chance anymore to lose this mark in another station by hitting the patient, or by if the patient say you, yeah, oh ouch, or patient say you are painful, or you are hurting me, whatever the welfare means. So if you fail in this skill in two station, you will not pass this exam. On the other hand, most of the candidates, they can gain the all or the full marks in this skill in particular. If you see the feedbacks, most of the examiner give you the full marks, because it's something should be maintained. We are not tough that much to hurt the patient. We are always gentle and asking for permission to examine the patient, warning the patient that my hands are cold, that you might feel some pain. Just a word before starting examination. Give him some warning that it might be painful, and by this way you will maintain the concern of the skill of welfare. Okay. Anyone has a doubt about the skills or the mark distribution?
No, Dr. Bassem, thanks for explaining it very well.
Yeah, it's clear for you and all right. Anyone has a
Yeah.
doubt?
I just have a question, Dr. Bassem,
Yes.
regarding the scenarios where we should be doing safety netting. So,
Yes, perfect.
particularly like in like serious conditions, like for example, hypoglycemia, unawareness, hypoglycemia, um, possible cancer. So, the safety netting in this scenario, when it's essentially calibrated, is it part of the welfare of the patient or is it part of your clinical judgment?
I don't think it's both of them. It's something
I mean,
complementary. Yeah, yeah, I
it's
know.
one of them because
I got
I
your
heard
point.
one of the mentors, to be honest, saying that safety netting is part of the welfare, and I don't know because in most of the times under exam stress, most of the people
Okay.
might forget that, and this would be a very like it's a small margin, as you say. Like if
Yeah.
you forget it,
Okay. Let me tell you how to
then you lose
overcome
marks.
this problem. Okay. Always at the end of your station, in particular the communication, because it's always in the communication scenario. Okay, try to find some couple of seconds to tell the patient that if he felt unwell, if he felt abnormal sensation or something alarming, visit us in one sentence. That's it. So you maintain the safety netting. Unless there is something specific. For example, paracetamol toxicity. Patient with paracetamol toxicity, he want to go home. Please, if you saw your eyes become yellow, if your urine become dark, so you have some specific data to mention. Otherwise, Keep it in your approach always. Whenever you are ending or closing the scenario, say these sentences. But I believe I didn't see any of the feedback saying he didn't safety net the patient. Okay, uh, till this moment, I didn't see one or the other candidate who failed because of safety netting. But it can give you good mark whenever you are mentioning it. This is what I want to see. It's complementary and something the examiner can forget. If you do bad all over the scenario, he can give you good mark because you give him some safety netting at the end. You got my point, but it cannot minus you if you didn't mention it. Why? Because you have a lot of things to discuss in this scenario. Okay?
Okay.
Yeah. But keep it in your mind why I want you to be impressing the examiner that you are doing perfect. I have the confidence. I have the time to mention some safety netting at the end. I like to mention, and by the way, I did it in most of my stations in the exam. Why? Because whenever they are saying 2 minutes
Okay.
left, you will ask the patient, "Do you have any concern?" Usually, he give you one concern. If you finish the concern, what you will do? So you give him soft safety netting. Please, if you feel so, or you can offer him some leaflet or brochure. That's why you have to remember it at the end of your scenario. Okay?
Okay.
Yeah, but again, they will not minus you if you don't mention it unless it's a fatal decision. I want to go home and you didn't give him some safety netting. Or there is some alarming after you assure him this disease will not be like this. For example, functional disorder. Most of them, they don't have the alarming sign. But please don't forget to tell him whenever the symptoms deviated from the normal symptoms or usual symptoms, this is the time to be worried. Okay, I have it in the it was irritable bowel syndrome scenario, and at the end I give him some of the safety netting. I told him whenever your diarrhea will be uncontrolled, whenever you feel blood in your or you saw blood in your stool, or you have decrease of your weight, you have to come or to call us immediately. And I got 16 out of 16. What I want to say, these things make the examiner feel that you are very professional. Okay. Even the scenario wasn't about irritable bowel. Imagine the scenario was about medical error. Patient took steroid and no one informed him about the vascular necrosis and he got it. He had this fracture because of the steroid and no one mentioned to him this steroid can lead you or can lead to the fracture. So the error was about the scenario was about an error and the error because of the steroid. What if the background is irritable bowel syndrome? Say I finished the all steps of medical error and at the end I give him some warning letter and warning symptoms that if he feel, which is the safety netting, please visit us. And I said it's 16 out of 16. Not only because of the medical error steps, no, I think also because of the safety netting at the end. And I didn't get any comment from the examiner in this scenario. Okay, so please, you can do it or do it as an habit or as a habit at the end of the communication scenario whenever you finish the task and the concern, support, and so on. Whenever you offer leaflet brochure, give him some safety netting advice. If you have, please let us know or visit us or call us in one sentence. It will not take 3 or 4 seconds. If you have any of these symptoms, please call us. So at least you give him, and it showed the examiner that you are professional. Okay. Any other question? Okay. Thank you, Dr. Aisha, Dr. Mahjoub as well.
Uh,
Yes.
Dr. Basim, I wanted to
Yes.
ask, like, as you said, that, when we go to the one station and they give us marking. So is that marking in front of us? Like,
No,
will
no,
they?
no, 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 no. You cannot see them. They will
Uh,
take the paper from you,
okay.
and you will write whatever they want to write, and you will not get the paper again. They will take it and give it to the control.
No, all these seven or six or four skills that we are
Yeah,
supposed,
yeah.
they're gonna judge. So they're not gonna judge it in front of, like,
No, 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 no. They are hiding.
okay. And so how do I know that they marked it like this for me?
Yeah,
I'll
after
get
the exam. After the exam, you will ask for the feedback and you will see it in the mark sheet.
the same day. Will
No,
it be
no.
the same?
Whenever the result released, you can see
Okay,
it. After
and
the
we don't.
result will be released, you will know what skills and the mark in this skill all over and the mark of the exam all over and in details.
Okay.
But if you want to know the comments, the
Uh-huh.
feedback, you have to request the feedback.
And the
Request.
feedback is not on the same day, like
No,
it.
no, no, no. It will take almost 1 month. They will
Okay.
email you with the feedback.
Okay. Okay. Thank you,
Yeah,
Dr. Bass.
I know most of the can as a first attempt, they don't know all these details. So you have to
Yeah.
know. Ask about
Mhm.
these things. Otherwise, you will see the examiner is writing something. You will
Yeah.
feel panic. What he's writing? Oh my
Yes.
God, is
Yeah.
it?
Yeah.
Yeah.
Is it
Don't look at him at all. Okay.
okay?
Don't look at him. Otherwise, you will be panic.
So like he will be writing even good thing, like
Yeah,
how?
exactly. That's why don't look at his handwriting. Look at his face.
Okay.
Sometimes they are writing good comment, positive comment. It's not only feedback as bad feedback. Some of them they are writing that you completed the skill well, you did properly this skill. He asked about this, he examined this. So it's not the matter of the negative feedback only. Okay, so don't look at his handwriting. Forget about it. Just focus on his face. Look at him and his eyes. Do your
Mhm.
exam as you are not with the with I'm meaning don't focus on his hands. Okay.
Yes, because Dr. Basim, when we are in our clinic, when we are in a very comfort zone. Like, this is all
Mm.
like, uh, I don't know. Whenever I'm practicing these cases, I just feel like it's not real for us. Like we don't do it like
Yes, it's a show.
it's
I'm
a it's
always
a yeah,
saying
it's like a drama. It is not
yes.
coming every time when I'm doing it, even like as you said that you should record and try to practice. So when I'm practicing, like, yeah, I know my disease, I know but it doesn't come
No,
natural, like when I see Dr.
exactly.
Lamis or
Yes.
Dr. Omar. I mean, they're doing so
No,
they're
no,
just
no.
doing it so fluently, and I'm feeling more very nervous. I don't know.
So Aisha, it's a matter of show. I want to show the examiner that I am examining the patient well. I am taking care of his welfare. I am addressing his concerns. I am taking history in a proper and organized way, not haphazard, randomly questioning, and I take care of the welfare as I mentioned. So
Mhm.
it's and I am asking about the differential in my history. One question to show
Mhm.
the examiner that I ask about the differential, the examiner will know that you are expert. For example, yesterday session, when I have acromegaly, I have to ask about men one. Maybe
Yeah.
in two questions, you have any polydipsia or feeling thirsty or any tummy pain. So
Mhm.
I will show the examiner that I asked about these things, putting in my mind this could be as a case of men one. And he will know that, by the way, they know what you are doing and they are commenting in the feedback about the good things you did, not only the bad thing.
Okay. Okay.
So don't
Yes.
worry, do your best and wish you the success.
Thank you so. Thank you so
Oh,
much.
okay, thank you, bro.
Uh,
Any other question? This is the most lengthy session because we did it in 2 years, 2025 and 2026. We started in the 2025 and we finished 2026. So wish you a happy and not a happy, all everyone and every candidate very happy and hopefully he will pass this exam. It's not horrible one. I believe it's just smart way you can pass this exam if you be being clever how to show how to do the proper way of examination taking history you will do it. So again I wish you all of you the success in this year before even the end of year. So maybe the next diet any one of you has exam in next diet hopefully we can pass inshallah. Thank you Dr. Omar and Dr. Lamis. Again, wish you happy new year and success in this year, all of you. Another also wish for the weekend, tomorrow and after tomorrow. So we'll see you inshallah on the Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamu alaikum.